Here there is a chance that you're dealing with a fussy crying baby who just won't stop no matter what you do. I know how exhausting and stressful that can be, but don't you worry, I get you covered. Today in this video, I'm going to walk you through the prevent techniques that help to soothe a crying or a colicky baby so that you and your little one can finally get some relief. But before we jump into solutions, let's first take a minute to understand what colic is. Colic isn't just baby fastness, it is inconsolable crying in an otherwise healthy baby. It follows the rule of threes: crying for more than 3 hours a day, crying for more than 3 days a week, and crying for 3 weeks and more. It usually starts when the baby is around 2 to 3 weeks. It kind of peaks when the baby is 6 weeks and reduces or improves by itself at around 3 to 4 months. Someone might say it is easy for you to say when you're not in it. Well, I totally understand. But I want to assure you that this is temporal, like it is going to end. It can happen. It is very stressful. It is very exhausting. But remember, always keep this at the back of your mind that is going to end. It is just temporary. It has come and it is going. Well, in my previous video, I kind of explained why and what brings about colic in babies. And I also mentioned a few ways how to prevent colic in babies. So after watching this video, you can always go back and check it out. Maybe it will be helpful for you if you're having a colicky baby right now and it is not your last born. Maybe when you check out how to prevent colic in babies, it can help you on your next pregnancy. And also if you're pregnant, it will be very helpful to you. Or if you know somebody that is pregnant, well, after watching this video, go and check it out. So let's talk about the signs of colic in babies. You could be dealing with a baby that is crying so much or that is too fussy and you're wondering, is it just the normal crying or is it colic? Here are some signs that you refer to give you a clear picture whether it is colic or not. First one is intense and high-pitched crying. Second sign is crying that happens the same time of the day every day, oftenly in the evening or afternoons. The third one is tight fists. This is what I mean by tight fists. Arched back when the baby is, like when the back is arched, or stiff body, like the baby is really stiff while crying. Or sometimes the baby could be crying while pulling his or her legs towards his tummy, like, I can do that on camera, but you know what I'm talking about. When the baby is crying but pulling his legs towards his tummy. Then lots of gas and bloating. You can tell when the baby is usually passing out a lot of gas oftenly. Or sometimes the baby is going to struggle to pull. The next sign is the baby turns red while crying. Like that crying, the baby cries so much to an extent that he or she turns red or pink, but then suddenly stops when soothed or distracted. Well, at this point, before we go into the proven techniques to soothe a baby or a crying baby, let me take a moment to welcome everyone that is new to this channel. Please go ahead and subscribe so that you can join this beautiful family. Give this video a thumbs up and let me know in the comment section what you think of the video, or if there is anything that you need to know or you would like me to share or get some research about. Please go ahead and let me know in the comment section. And for your returning subscribers, I always appreciate you. Thank you. The first technique is the 5 S's method. Dr. Harvey Kapp's 5 S's is one of the most effective ways of calming a baby. These techniques mimic the mom's womb and also triggers the baby's calming reflex. Remember, we're talking about S's, the 5 S's. The first S is swaddle. Swaddle your baby. In this case, you're going to wrap your baby snugly in a warm, soft blanket. Here's what I mean. Let's welcome baby Mickey. This is what I mean by swaddling. Like you wrap your baby inside a warm, clean, comfortable blanket, just like this. The second S is side or stomach position. In this case, you're going to hold your baby in your arms, but on the side or stomach position. Stomach position or side position. The third S is shush. You have to shush your baby. Use some white noise. Play some soft background music for the baby. Even whisper shh in your baby's ear. The fourth S is swing. Like swinging. Sway your baby while carrying them. Put them in a rocker. If you have a rocker at home, place them in a rocker and then keep on swaying them. It will help. Last is suck. Give them a pacifier, give them a clean finger to suck on. This is really going to help soothe them. Game changer, I told you. Will certainly makes babies feel secure, and the combination of white noise and movement can be incredibly soothing. Let's go to the second technique of soothing a baby: relieving gas and tummy discomfort. Gas and digestion are a very huge part of colic. So this is how you can help to relieve gas from your baby. First of all, burp your baby. Hold your baby upright every after a feed. Hold your baby upright and then gently pat in their back so that they can, burp or belch, so that that gas goes out of their tummy. You can do a tummy massage clockwise like this, or you can move your baby's legs in a bicycle motion. Then you can also try a warm bath for the baby. It will do them well. The third technique is adjusting feeding techniques. Colic sometimes is linked to feeding. So if you're that person that is suspecting something like that, you need to take this into consideration. Use an anti-colic feeding bottle nipple. These are really designed to reduce the air that a baby can take in while feeding on the bottle. Ensure a proper latch on the baby. Make sure when the baby is breastfeeding, the nipple is completely covered within the mouth so that there is less air that is coming from out. Do paced bottle feeding. Make sure the bottle is horizontal and not vertical so that the baby doesn't gulp, and then it will still reduce the kind of air the baby is taking in while feeding. Check for food sensitivities. If you're breastfeeding, make sure you eliminate dairy products, caffeine, or spicy foods for about a week. See whether there will be any change. Let's go to the fourth technique of soothing a colicky baby, which is create a calm environment. Babies can get overwhelmed so easily, so creating a calm environment, it will do well for them. This is how you can do it. You can dim the lights in the room where the baby is or where you're usually breastfeeding or taking care of your baby from. Use a white noise machine or play some gentle music, or you can use a vacuum cleaner. Put it in the background so that that sound kind of distracts the baby. Try skin to skin contact. It could be you or it could be the father or any caretaker that is around, and then walk around. Trust me, it will help. The fifth technique of soothing a colicky baby is baby wearing and movements. One thing about babies, they love being close. A baby carrier will allow you to be close to your baby and to walk around with your baby without, holding them, while providing constant movements. Try a wrap or structured carrier for closeness and comfort. Go for a walk outside with your baby. Fresh air and movement can work magic on your baby. When do you need to see a doctor? You've done everything that I've mentioned above and there is no change, and you feel something wrong is happening to your baby, or there is more to the baby's crying than just a colic. So when are you supposed to see a doctor? Well, colic is normal. There are times where baby's crying signals something else. You need to call your doctor if your baby is having a fever, is having frequent diarrhea or vomiting, struggling with feeding, and as well not gaining weight. As a mom, you need to always trust your instincts. If you think something is not right with your baby, always check in with a doctor. I know it feels like it will never end, but colic is temporary. As a mom, I want to assure you, you are doing an amazing job. And your baby loves you, of course, even if he or she is crying endlessly and won't stop. Be patient with yourself. Take breaks whenever you need them. Ask for help from anyone, friends, family members, anyone that is available to give you help. Please take it. And for your moms that are watching this, if you have any colic soothing tips that I've not mentioned above, please go ahead and let me know in the comment section so that we work hand in hand to help a mother that is struggling with this kind of issue. If you're new here, feel free to join the beautiful family by subscribing, liking, give this video a thumbs up, tap the notification bell. You're that kind of person that is interested in parenting tips, motherhood content, and household related kind of content all together. Do well to go ahead and tap the notification bell so that you're always notified every time I upload a video. And for your returning subscribers, thank you. Let's meet in my next video. Bye.